Today, we're cracking open the medicine cabinet to talk about a class of drugs that millions of people take, well, every single day, blood pressure medications. So let's just dive right in and see how these remarkable little pills actually get the job done.
I mean, you've got to wonder, right? It feels a little bit like magic. You take this one small pill, and suddenly this huge, complex system inside your body just changes course. But you know what? It's not magic at all. It's just some really fascinating science. And we're going to demystify exactly how these medications pull it off.
So here's our game plan. We'll start with the absolute basics. What even is high blood pressure? Then we'll explore the four main tools doctors have in their toolkit to fix it. Drugs that relax the system, some that hack its hormones, others that tame the heart, and finally, the ones that manage fluids. And we'll wrap it all up by looking at how a doctor chooses the right tool for the job.
Okay, so first things first. Before we can really get into the solution, we have to understand the problem. What are we actually talking about when we say high blood pressure?
Honestly, this is the best and simplest way to picture it. Your entire circulatory system, it's just a massive, intricate network of pipes, and your heart is the pump. So high blood pressure, or hypertension as it's technically called, it just means the fluid, your blood, is being forced through those pipes with way too much oomph. And over time, all that extra force can really start to damage the pipes themselves.
So, if the pressure is too high in the pipes, what's the most direct solution you can think of? Yeah, just make the pipes bigger. And that's exactly what our first class of medications does. For our purposes, let's call them the relaxers.
The fancy scientific term for this whole process is vasodilation. You've got vaso for vessel and dilation for widening. It's pretty straightforward. These drugs relax the smooth muscles that line your vessel walls, and that increases the diameter of the pipes. Simple physics, right? The same amount of liquid flowing through a bigger space equals less pressure.
Now, there are two major types of drugs that get this vasodilation done. You've got calcium channel blockers, or CCBs, you've probably heard of those, and then there's another group called alpha-1 receptor antagonists. They work in slightly different ways, but the end goal is exactly the same: relax and widen those pipes.
Now here's what's so cool about this. Look at the side effect. It's directly tied to how the drug works. CCBs are fantastic for hypertension and for a type of chest pain called angina. But because they're widening blood vessels all over your body, that can sometimes cause fluid to pool in your ankles, that's the peripheral edema, or make you feel flushed. It's a perfect example of how the solution itself can cause its own unique set of problems.
Okay, let's move on to our next tool. This one is less like plumbing and a little more like, well, computer hacking. Instead of just physically making the pipes wider, these drugs actually interfere with the body's own internal messaging system for managing blood pressure.
You see, your body has its own internal pressure sensor, and when it thinks the pressure is getting too low, it kicks off this chain reaction that produces a really powerful hormone called angiotensin II. Now, this hormone does the exact opposite of what we want. It's a vasoconstrictor. It literally squeezes your blood vessels, making the pipes narrower to crank the pressure right back up.
So this gives us two really clever ways to hack that system. First, you've got ACE inhibitors. They stop the body from even making that pressure-raising hormone in the first place. Then you have RBs. They let the body make the hormone, but they block the receptors it needs to plug into to do its job. So it's kind of like one drug stops the key from being made, and the other one just plugs up the keyhole. Same result.
And this gets out why a doctor might choose one over the other. See, while they both work great, ACE inhibitors are famous for causing this nagging, dry cough in a lot of patients. But ARBs, they can get the same job done without that common side effect, all because they jump into the process at a slightly different spot.
All right, we've talked a lot about the pipes, so now let's talk about the pump itself, the heart. Our next set of tools, the beta blockers, are all about making that pump work just a little less hard.
Think of it this way. If you can't make the pipes bigger, you can just pump less fluid through them, or maybe pump it with less force, right? That's exactly what beta blockers do. They block the effects of adrenaline on your heart, which tells it to beat slower and with a little less oomph. And that, in turn, reduces the overall pressure in the whole system. This is why they are so important for patients who've had a heart attack. They basically give that heart muscle a much-needed break. And again, look at the side effects. They make perfect sense. If you're slowing the heart down, well, you might feel a bit tired. And the medical term for a slow heart rate is, you guessed it, bradycardia.
We've got one last tool in our kit. So, we've widened the pipes, we've hacked the signals, we've slowed down the pump. What else is there to do? Well, we can just reduce the amount of fluid in the system altogether. Let's meet the fluid managers. These drugs are what a lot of people call water pills, and they work on your kidneys. They basically convince your body to get rid of extra salt and water when you pee. It's a really logical approach if you think about it. Less blood volume moving through the pipes means less pressure on the pipe walls. Simple as that.
Thiazide diuretics are actually one of the oldest and most common treatments for just simple, mild hypertension. They work well, and they're not very expensive. But, and this is a big but, the key thing for patients on these is that while you're getting rid of all that extra sodium and water, you can also lose too much potassium. That's a condition called hypokalemia, and it's why doctors often have to monitor those levels.
So we have this incredible toolkit, relaxers, hackers, tamers, and managers. But how in the world does a doctor know which one to pick? Well, this is where medicine becomes both a science and an art.
So let's just pull this all together for a second. We have our complete toolkit right here. We can attack the problem mechanically, either by widening the pipes with the relaxers or by reducing the fluid with the managers. Or we can take a more biological route, slowing the pump with the heart tamers or intercepting the body's own signals with the hormone hackers. 4 totally different strategies, each one hitting the pressure problem from a unique angle.
And here's the most important point. The choice is always highly personalized. For example, for a patient who has kidney disease because of diabetes, a doctor will almost always choose an ACE inhibitor or an ARB, because those drugs also happen to protect the kidneys. For someone who's just had a heart attack, a beta blocker is absolutely essential. It is never a one-size-fits-all approach.
And that kind of leaves us with a final thought, doesn't it? We've gone from simple water pills to these incredibly sophisticated hormone hackers. Every new step represents a deeper and deeper understanding of the body's crazy complex machinery. It really makes you wonder, what's going to come next? What will the next tool in the kit look like as we get even better at targeting the precise cause of the pressure in the system?